Hello, everyone. My name's Lindsey Bufford. I'm one of the psychiatric mental health nurse practitioners here at Memorial, around on the inpatient units upstairs in our mental health department. And I also have an outpatient clinic with the psychiatric center. So we were approached to kind of talk about that transition into retirement. We find that a lot of times we plan, but we plan financially. We focus a lot on the financials and maybe even some of the travel, and not so much on our actual mental health preparedness as we transition into that time of our life. So like I said, we all know it's coming. Let's see. And our picture sometimes of retirement, you know, the commercials, the brochures, we start talking about traveling, playing golf, seeing the country, being adventurers through all of this, and that's what we kind of refer to as the honeymoon phase, and that's just a piece of the bigger picture. That's not exactly this permanent vacation that we're going to be on for the next 10 to 20 years. So when we talk about retirement, approximately 10% of the people are self-directed, meaning once they retire, they move on quickly to other interests and hobbies. They keep a similar daily routine as when they worked and remain mentally and physically healthy. They view retirement as a new phase in life with new challenges and new successes. The rest of the population, we find this transition quite challenging. They're no longer pressured to meet deadlines and goals. You're no longer facing challenges or putting out fires. This almost permanent leisure becomes a barrier. People often fear missing out on events, activities, while others miss kind of that authority and influence that they provided at work. When we talk about that fear of missing out, there's an acronym. And if we're in the texting world these days, you know, the kids, the grandkids, everything's an acronym, whether it's an IDC for I don't care and IDK for I don't know, and good luck trying to read those texts. I even have problems sometimes. Google what is, you know, ROFL. That come across a lot, and apparently it's rolling on the floor laughing. You know, so FOMO, like we call it, fear of missing out is actually what that one means. Text it to your grandchildren, see if they know that one. Tell them you know one they don't know. So this fear of missing out, it's kind of an epidemic. It's really increased with social media. This fear is almost an anxiety in some, that they may miss out on something exciting. Social media is full of pictures, videos, comments about friends going to new restaurants, concerts, vacations, buying houses, getting married. The images that everyone else is in is just this constant world of excitement. And we're sitting at home on our couches at some point, just able to click like, or put a little heart there, or put something sad up there, you know. Now we find, though, that with the baby boomer generation, they're not really as driven by social media, but more by a feeling of no longer being meaningful and involved in the world. The actual world, not so much the Facebook and Twitter world, but like the real world, getting out there again and having a purpose. Many people will even delay their retirement based on that concept of not wanting to miss out on the action, the people, and the energy of work. A longing to feel needed by others and the ability to provide the answers to the questions and solutions to problems. Some people say they can't wait to retire and dislike their jobs. What many don't realize is even though your day consisted of meeting up with coworkers, out on a coffee break, just to kind of gripe about work. You visit with vendors during the day, delivery people, maybe even get involved with training new hires. This keeps us talking, it keeps us socializing, you know, through the day, on and on. Work's more than just a place that you just spend your time. So when we talk about the hidden value in work, what we're referring to is that financial stability of work, the structure that it offers, the socialization, the belonging to a community, and to have a purpose and even career satisfaction. When work is removed, so are those hidden values. It's very important to replace these values with a positive influence to avoid isolation, depression, and deteriorating physical health. So that leads us to depression. And we got to talk a little bit about this because it's easy to slip into whenever we have such a big change in our lives. You know, many of you may have never experienced depression until retirement. Others may have struggled with depression most of their lives. But we want to talk about the depressive symptoms and how they change as we age. You know, in our younger years, the children, a lot of irritability behaviors, sometimes kind of acting out. They're just not sure how to be sad. And then whenever you're in your adult years, it's different. And then even once you get a little bit older, things kind of change. Most importantly, depression is not a normal part of aging. Don't think just because you're getting older that you're supposed to be depressed, that just comes with it. And that's very important to remember. Depression is not a normal part of aging. And we'll talk about those symptoms so you can kind of figure out, or be aware of that. So we have this cool little book called the DSM-5, which is actually our diagnostic and statistical manual of mental disorders. They're on their 5th edition, and it's kind of our guide when we're diagnosing things. And so based on that guide, these are what would qualify you for clinical depression. You have to have a depressed mood most of the day or nearly every day, or a loss of interest or pleasure in nearly all activities for at least 2 weeks. You have to have these there's symptoms I'm about to list for you, and it's 5 or more of those symptoms must be present during the same 2-week period and represent a change from your previous functioning. And one of those 5 symptoms must be either that depressed mood or loss of interest or pleasure. And 2 weeks isn't a long time, but what we've noticed is that's when, if for 2 weeks you consistently feeling this way, well, you're getting on week 3, and we all say, you know, it takes 3 weeks to make a habit. So you're getting into that. We want to catch it early. So some of the most common symptoms of depression among older adults include persistent sadness, feeling slowed down, excessive worries about finances and health problems, frequent tearfulness, feeling worthless or helpless, weight changes, pacing or fidgeting, difficulty sleeping, difficulty concentrating, and what we call some somatic complaints, which include things like physical pain, GI upset, which is, you know, having stomach problems or bowel issues. Sometimes the arthritis gets exacerbated, things like that. There's also, well, and this kind of is also what puts you at risk for worsening that depression. Medical illness, usually if there's problems like with chronic, painful, debilitating, or life-threatening medical problems. And then also some medications can cause depression, such as the heart medications, the seizure medications, anti-inflammatory meds, you know, things that you sit here and you need every day and you're treating it, don't realize some of those side effects are depression. Now, I'm not telling you don't stop your medicine. Don't, hey, you know what, I'm feeling depressed, let's get rid of these heart meds and seizure meds. No, what I want you to do is recognize that and remember, hey, you know, I am on some of these meds, maybe we need to take a look at this. And then go to your provider and y'all talk about your med list. Decide, is this med necessary? And if it is, then let's treat your depression, because you know you need to stay on your heart medication or your seizure medication. And suicide, that's a toughie, but we have to talk about it. The risk of suicide with depression is definitely there. There's an increased risk for that. The second highest suicide rate occurred in people ages 85 years and older. The first highest rate of suicide, though, occurred in adults between 45 and 64 years of age. Even though a past history of suicide attempts does increase that risk, most successful suicides that we've seen are not preceded by a previous attempt. If you're feeling this way, or you know someone that is, or showing any kind of signs of depression, it's very important to let someone know and to seek professional help as soon as possible. You know, talk to each other about it. And then there's professional treatment for depression. And there are multiple options. You know, some of you think, oh, I'm already on all these medicines, I don't want another medicine. Well, it's not the only way to help with depression. So once we recognize there is a problem, it's not a normal part of aging, let's talk about those options. Psychotherapy, like I said, it's kind of a fancy word for therapy. And what you can do with this is they have cognitive behavioral therapy, which we found to really help with that type of depression that you're entering into. It helps to address those negative thinking patterns and behaviors. They also have something called talk therapy, and this is also a very helpful source of support. There are other types of therapies out there, but these are the two that really popped out whenever we were talking about retirement and depression and the types of therapies that helped. Support groups. These groups are designed to help people connect with others experiencing similar issues. These groups provide social support and a safe place to talk. And then, of course, we have to talk about medications, and they have antidepressants, among many other classes of medications, to address the depression, and even if there's anxiety involved in that. We find they do come kind of hand in hand. One comes with the other, depends on who started it. Either anxiety started it and then you become depressed, or you were depressed and then the anxiety picked in. And then we also have lifestyle changes. This includes daily exercise, healthy eating habits, increasing social support. And we're going to talk a lot about socialization and not realizing that what we had at work and that social support that was up there, you tend to kind of start feeling a little lonely whenever you're after retirement. And that's one of the big things that you want to try to prevent and stay in those social circles. So, I want to address depression and dementia, and the reason I do is because a lot of the symptoms overlap. So I don't want you to think, oh man, something's wrong with my memory, I'm forgetting things, and then the first thing they say is, oh, I'm getting dementia. So let's talk about what actually the differences are there, because depression does come with some memory loss because of the mechanism itself. Depression, we find there's more of a rapid mental decline. Dementia, it's a lot slower. You gradually enter into dementia. It's not something that just happens like last week she was fine, this week she's not. Usually in depression, you're still oriented. You know the date, you know the time. We find in dementia that confusion, that disorientation, not sure what dates and times are, is one of those symptoms. You're going to have difficulty concentrating at times. Some people do it with depression. Even your language, your motor skills, they're normal, but they're just a little delayed. Like you have a harder time maybe getting the word out, or you just trying to, remember what you had to say. You'll see that in depression, but with dementia, they don't seem to notice that there's an issue. Like they don't realize, that there's a memory problem going on. Those language and speaking and writing skills, they start becoming impaired. So in your depressed patient, you're going to notice. You're going to worry about your memory issue. You're going to worry, hey, why am I so confused all the time, So just some big differences. So if you know someone or if you're feeling any of this, get with your doctor, your provider, your nurse practitioner, and make sure y'all rule out depression before we just jump on the dementia train. The retirement journey. So kind of back onto that transition. We discussed the professional ways to treat clinical depression, but now let's talk about more of just avoiding slipping into that clinical depression and ways to kind of mentally prepare for retirement and prepare for it. We want to maintain a positive outlook. Financial independence, look at it as a new phase in life, a time to rediscover yourself and reconnect with your roots. Show appreciation for everything that you're grateful for. Keep yourself involved. Figure out what you love to do and make it more than a hobby. Learn more about it and make it your reality. Relationships. Finding that hobby is great, but sharing your interest and enjoying those activities with other people that you care about is really everything. Quality relationships with existing friends, significant others, and making new friends helps to keep you motivated, energized, and strong. And then to have a meaningful life. Living a life with meaning gives you a sense of purpose, making you feel significant. Some people volunteer and provide a positive impact on others, socially, spiritually, environmentally, and even maybe physically. Volunteering and helping others makes most people feel that their life has meaning and purpose. And then there's a sense of achievement. This motivates people to keep looking towards the future, setting goals, and allow you to grow, recognize, and celebrate your free time and newfound independence. Increasing our awareness of the retirement journey also allows us to prepare mentally. Robert Ashley was a professor of gerontology that developed a model identifying those 6 stages of retirement. And it's important that we know these stages of retirement so that we can understand what we're going through and recognize that we're not alone in this journey. We have kind of a modified version of his stages so that we can kind of relate to it. And these are his stages here, and we're going to talk about each one of these individually. So that pre-retirement or planning time. This is the preparation during the work years. Most of us, like we said earlier, focus on financial preparation and forget the mental preparation. And then there's the big day, the farewell parties, the actual day of retirement. This is actually the shortest stage in the retirement process. This is the last day of work. There's usually some type of celebration if the retirement is planned. Others, however, retirement day may not be positive, especially if it was forced or unexpected retirement due to layoffs or illnesses. And then we have the retirement. And there's 3 paths that were identified for the actual retirement. We have the honeymoon phase, like we mentioned. This is a period when retirees focus on doing all the things they wanted to do once they retired. This includes traveling, indulging in hobbies, visiting relatives and friends, and so on. There's no set time frame for this phase and will vary depending upon how much activity the retiree has planned. The other path that some people take in this phase is the immediate retirement routine. Typically, this path is taken by individuals that maintained a busy schedule outside of work. Now that they no longer work, it no longer interferes with their extracurricular activities in that schedule they already had planned. So they usually continue existing in that schedule minus the work and just go right into that role. And then the other path that some take is that rest and relaxation path. These are typically individuals that have had very busy careers with limited time to themselves and tend to do very little in the beginning of their retirement years. And then our disenchantment. So this is moving into another phase. So after you've completed the last phase and you've had that retirement, you've done all those things, now you're looking back and kind of like, so now what? You know, I went on all my trips, I visited everybody, what am I going to do now? It's kind of the emotional high has worn off, and it's pretty much like a time for business. After looking forward to retirement for so long, many have to deal with kind of a letdown when they realize retirement is not a permanent vacation. You may question your decision to retire and purpose in life. Loneliness, boredom, and feelings of usefulness can set in. The loneliness is increased if most of their friends and family are still working. The transition from working and saving to retirement and spending may be one of the toughest for most retirees. This transition is emotionally and financially harder than expected. It is very important when planning for retirement to include not only that financial plan and budget, but also that extracurricular plan, like your fun plan. You want to include places you want to visit and things you want to do in your budget when you're planning to retire. The reorientation, or building that new identity. As you move on to this phase, you realize the disappointment or letdown of the previous phase does not last forever. You're like, whew, I'm glad I'm out of that, but guess what? This one's a toughie, because now you have to familiarize yourself with this new chapter in your life. It takes a significant time and conscious effort to do this. It's one of the most difficult stages emotionally. And I say this because this phase, you must self-reflect and ask yourself some self-examination questions. You need to answer these questions. You need to sit down and think about it. You want to know, who am I? What is my purpose at this point in my life? Am I still useful in some capacity? Why am I unhappy? And do I really regret retiring? Do I miss that paycheck? And do I miss the feeling of being productive and that work provided? You must seek new and satisfying answers to these questions if you want to feel a sense of closure. If you answered yes to any of the questions, you need to determine that solution. Consider obtaining a self-help book related to the issue you're dealing with. Many people begin volunteering to feel productive. It offers a sense of socialization, and there's a schedule that comes with it. It gives you a reason to get out of bed every day. This stage is very difficult to escape, and make it a point to complete and escape this stage of retirement. We tend to, if we don't make those schedules, and sometimes we say make that schedule the night before for your next day, because when you wake up that morning, you're just kind of looking around like, I have all this time, what am I going to do today? You know, and you're just constantly racking your brain for things to do. getting involved in volunteering, and I don't mean go 7 days a week, but do what you need to replace that socialization you had from work. And there's just a sense of meaning when you're helping others and you're offering that wisdom. You know, I've talked to a lot of people and they really enjoy helping adolescents and kind of that life skills, that journey, kind of giving that advice. I have one friend that does it with the juvenile detention center and just kind of talking to those kids and kind of helping them get on the right path. That's not for everyone. That's a tough environment to be in, but they're not all tough like that. Pick what fits for you. So moving on, now we're in a routine, finally. We've figured out this whole retirement thing, maybe. Some of these phases do overlap. You may still be searching in one and end in another. So it's not like you're gonna find that exact day where you're like, boom, I'm out of that phase, I'm into my next one. There may be a little bit of an overlap. It's more of a, you're gonna look back and say, hey, this is what I went through. So you've created a new daily schedule. If you have a significant other, maybe new ground rules are discussed regarding time together and time alone. And eventually these new routines become very familiar and you begin to enjoy this phase in your life with a new sense of purpose. The retirement journey. This model was created to help you understand what you're going through and that this transition emotionally is normal, and it provides a guide so that you know you are on the right track. Newly retired is kind of like newlyweds. You're riding a roller coaster in the beginning, but with the proper attention, work, and patience, you will adjust and develop a new norm that is just as satisfying. And that's kind of our transition, you know, into that journey. And this is the goal. This is where you want to end up in that last phase where you've developed your new routine and you're into this new life transition. You know, we have our high school years, you have your college years, maybe married, maybe had kids, maybe didn't, maybe traveled and worked. You have your career part, and then your retirement phase. And so there's an adjustment with every one of those. And as we get older, sometimes we have a harder time making those adjustments. Things we used to cope with and deal with really well when we were younger kind of stress us out a lot more when we're older. So recognizing those things and giving them some attention. Don't just push it to the back of your head. Do you guys have any questions so far about any of this?